My name is Neva Detling. I'm a singer and a songwriter, and I was diagnosed with kidney disease in 2008. Okay, I can handle that. And then she said the word transplant, and I just started to bawl. I started crying.
My mother, who was 82 years old at the time, we had just learned that she had pancreatic cancer. I wanted to have my mother visit City of Hope, UCLA, and USC.
Being a musician, when I found out I had kidney disease, I thought my career was over. I was afraid that I would be on dialysis 4 times a week, or after the transplant would be on medications that would compromise my voice.
I talked to UCLA, and when they found out my mother was 82 years old, they wouldn't even set up an appointment. And so in Los Angeles, we only had really one last good hope, and that was USC. And my research said, you know, you want to talk to Rick Selby. My mom had 3 of the best years of her life after the surgery.
And I remember telling my mom, Mom, if I can't sing, I don't want the transplant. It's not worth it to me. I'd rather die.
You know, when we look at the wait lists nationally, California, Southern California, you know, some 8,500 or so people waiting for an organ transplant, but 85% of those are waiting for a kidney.
One of the jewels in the crown of the Keck Medicine of USC is our kidney transplant group. They've recently been ranked in the top 10 of all kidney transplant centers in the United States.
When Dr. Selby arrived here, there was a small kidney transplant program that existed doing fewer than 30 transplants per year. Since then, with the leadership of Dr. Qazi and Selby and the entire team, last year we did over 150.
My training is multi-organ transplant at University of Pittsburgh and hepatobiliary surgery. So I came with the express purpose of starting a liver transplant program because there was already a kidney program here, but it was within the purview of us to grow the kidney transplant program as well.
Quest works too, right?
This is Rosie.
Yeah, Quest will interface.
Kidney patients before transplant stagger from kind of one misery to the next, and then they get transplanted, and it's like a light came on. They feel like they haven't felt in 20 years.
There are a lot of good people that do that.
Everybody that is in transplantation has to relearn and rethink the way to handle tissue. And I think that's probably the biggest lesson for me in terms of becoming a surgeon is the precision and the gentleness that's required to actually get a good outcome in an organ replacement.
Dr. Qazi is just the coolest guy. He is such a blessing. He walked in the room, the whole place just lights up.
I did go to an engineering school for a month and a half, but very quickly felt out of place. Both of my parents are physicians, so my stepsister is a physician, my younger sister is a physician, so God forbid anybody gets sick in our home, you know, there's like multiple differential diagnoses that pop up.
Full cardiac arrest, significant head trauma, status post, MVA, auto versus...
In my residency, I kind of liked nephrology because it just happened, all the smart attendings were nephrology people. They were like always so impressive. It all comes down to that we don't want to just do a transplant, we want to have a good outcome for the patients.
Transplanters in general own the nights, they own the weekends, they own the holidays, and they own the next days.
And this one the dietitian is doing on the...
What really keeps a program going is to have the right judgment to be able to accept an organ and say, that organ's going to work.
When I first got here, you know, the coordinators would start out by telling me the other centers had passed on it, and I made it very clear I did not want to hear anything about who had passed on it, and I totally want to accept or reject an organ on the merit of what we as a team had made an analysis on.
He actually elevated the quality of the care that I delivered as a surgeon too, and he routinely pushes me in considering looking at kidneys that I normally would have passed on.
Aggressive, I guess the word we use, about finding kidneys for their recipients and finding that match of that, what is the right kidney for this patient. And it's really ramped up their program and given their patients on their lists a greater chance than they probably ever had before.
One of the best things about getting care at USC was I almost felt like I was a student there. They explained everything so thoroughly that I felt really comfortable with what they were doing and knowing why they were making the decisions they were making to change my medicine or to treat me in certain ways. I need that. I'm a type of person that needs that content to be okay with things.
It's a group that works exceptionally well together. It's borne out by the numbers. The volumes are increasing, the number of referrals are growing.
There was a very large family that couldn't speak English, and they were all speaking Spanish, and he must have spent over half an hour talking with them about whatever family member's case it was, consoling them, you know, hugging them, and you know, it appeared, you know, they were, you know, less fortunate family, and Rick treated them like royalty.
There's a Leonard Cohen song, Who By, and it goes by different kinds of death. I think I literally have seen every kind of death that there basically is. But to then take it and see something meaningful come out of this is the most gratifying thing that I can be a part of.
Every surgeon walks through his own cemetery late at night when he's by himself, and it's true from the standpoint of you have your outcomes that you wish had been different, and you still struggle with, you know, why that happened and how do you do it differently the next time. So in transplantation, one of the nice parts is that so much of it is successful, and the reward is such an abundance that you just can't stop.